Welcome to the Gastroenterology and Endoscopy Laboratory at Baptist Medical Center, Princeton. I'm Dr. Jack Mauldin. I'm a gastroenterologist. That's a subspecialist who deals with diseases of the intestinal tract, diagnosis, and cares for patients. I would like to talk to you today about a very important disease of the gastrointestinal tract, colon and rectal cancer. This is the number 2 malignancy that kills individuals in this country. Every year, 150,000 or so people will be diagnosed with colon and rectal cancer. Of those, 50,000 will die. 1 out of every 18 people in the United States will develop colon cancer at some time during their lifetime. That's a friend, a neighbor, a workmate, a family member, or perhaps you yourself. So it's very important to know what to do to prevent colorectal cancer. Colon cancer is the 3rd most common cancer in the United States. Breast and lung being the first 2 in women, prostate and lung in men. But colon cancer is the 2nd leading cause of cancer death in men and women. There are individual families that may have an increased incidence of colon cancer. If you have a parent or a sibling or a grandparent, then you should be evaluated earlier. If you have ulcerative colitis or Crohn's disease, you should be evaluated earlier. But in general, cancer of the colon begins as we age. Age 50 is chosen for Caucasians and 45 for Afro-Americans. So we should be screened for colon cancer even if we have no family history or personal history of the same. The most recent indications and recommendations by the American College of Gastroenterology are: the preferred type of colon cancer screening is colonoscopy because it offers the ability to prevent colon cancer. Currently, colorectal cancer testing should begin at age 50 and occur every 10 years thereafter. Certain people, like Afro-Americans, should begin at age 45 and continue at 10-year periods. There are other alternatives like CT-directed colonography, which also should be done starting at age 50 or 45 and every 5 to 10 years later. If you have no family history of colon cancer, no family history of polyps, and are Caucasian, you should be examined at age 50 and every 10 years thereafter. If you're Afro-American, the same rules hold, but begin at age 45 with an exam every 10 years thereafter. There are high-risk families, those that have a personal history of polyp or cancer, or a family member, such as a parent or grandparent or sibling who has cancer at age less than 60. Then they should be evaluated at age 40 or at least 10 years prior to the diagnosis of the disease in their family member, and then every 5 years thereafter. African Americans are a special population currently. They seem to have a higher incidence than average. They also have a worse outcome. So the current recommendations are starting at age 45 and every 10 years thereafter. And other things to worry about are smokers and obesity. These populations are extremely high risk for colon cancer and should all begin screening at age 45 and probably every 5 years. In addition to the time you should be screened and who should be screened, there are also indications and recommendations about how to be screened. One of those recommendations now is to use high-quality, high-definition endoscopic equipment, like this high-definition colonoscope at Princeton, as well as high-quality, high-definition video imaging. This enhances our ability to identify flat lesions, early lesions, and actually help us reduce the incidence of colon cancer by colonoscopy and polypectomy. Remember that 1 out of every 18 people here today will develop colon and rectal cancer, so be screened appropriately.